Okay, welcome everybody. I'm glad so many of you have joined. I see there's still a few people coming on, but we're going to go ahead and get started because we have a lot to cover today. We're happy you've joined the webinar. This is focused on childcare cost estimation, how childcare cost estimation modeling can inform decision making. I'm Nina Johnson with the Office of Child Care's National Center on Early Childhood Quality Assurance. And before we get started, I just want to go through a couple logistical items. So first of all, this session is being recorded, and the recording and slides will be made available on the Child Care Technical Assistance Network website in a couple of weeks. Secondly, we just want to let you know that everyone on the call is muted, so please type your questions into the Q&A box at the bottom. It's really important for you to share your questions. We want to hear from you, so we encourage you to type them in, and we'll do our best to answer them as we go, and then we'll save a few minutes at the end to address questions as we can as well. So in this webinar, Simon Workman and Jeanna Capito will discuss the goals of cost modeling, because you have to start with goals. Next, they'll talk through the cost modeling process, and then they'll tie it all together in a discussion about how cost modeling can support policy decisions. And then, as I said, we'll reserve time at the end for questions and hopefully answers. The Office of Child Care's National Center on Early Childhood Quality Assurance, in partnership with the BUILD Initiative, is pleased to introduce Jeanna Capito and Simon Workman with Prenatal to P5 Fiscal Strategies. We're happy you all have joined us. And I'm also happy to introduce Megan Campbell with the Office of Child Care. You'll hear from Megan shortly, and she'll also be on hand for questions at the end of the call. This is the fifth webinar in a series focused on exploring the cost of childcare. Prior webinar recordings and slides are available on the Child Care Technical Assistance Network website. The Office of Child Care's Child Care Technical Assistance Network offers a number of universal or group technical assistance events to support state, territory, and tribal lead agencies with the implementation of child care and development fund plans. During national and group TA events, participants can request additional technical assistance on any topic related to the American Rescue Plan Act funding online, or can contact their regional office, their state system specialist, or a tribal TA specialist who will coordinate with the Office of Child Care National Technical Assistance Centers to provide the support needed. Technical assistance services are funded by the Office of Child Care, and there is no fee to lead agencies. And we'll go ahead, or I think that actually someone already did drop a link in the chat box if you'd like to submit any TA requests today, and we'll remind you at the end of the session too. So before we turn it over to Simon and Jeanna to discuss cost modeling, I'll hand it to Megan Campbell with the Office of Child Care to discuss the current context. Megan.
Thanks so much, Nina. Hi, everybody. I'm Megan Campbell. I'm in the policy division in the Office of Child Care. I spent a lot of time with many of you, I think, last summer in webinars, so it's good to be back together virtually. And thanks especially for our lead agencies who are working on finishing up obligating lots of dollars this week. So it's great to be able to be here and look ahead at new ways of investing some of those funds. So I'm just going to quickly share a bit about the current context related to setting rates and the narrow cost analysis, alternative methodologies, et cetera, and a little bit of looking ahead before turning it over to Simon. So for the FY 2022-2024 CCDF state and territory plans, OCC allowed for waivers for lead agencies when it came to setting their payment rates, including the market rate survey and the narrow cost analysis, because of COVID, which impacted everything, but really to make sure there was enough information to properly view the market. Those waivers ended this summer. So as of now, all states should have completed that narrow cost analysis by now, or are reporting that information into us. And as part of that, each state has taken a different approach. There's a variety of different data sources, which you all are aware of, including using the provider cost of quality calculator analyzing data through the market rate survey, other cost modeling tools that are customized for that state. I've heard of a couple states taking advantage of the significant data you've collected through your ARP stabilization applications from providers to help inform some of that, which I think can be a very interesting and rich data source for folks. So those are some of the ways. In addition, lead agencies can propose to ACF that they would like to use an alternative methodology, so not a market rate survey to set those payment rates. And for this year, ACF approved for 3 lead agencies to do that. I think in the last one we approved 1. So we're making some progress on that one. And then also beyond just setting your payment rates or the information you provide us in your plans, cost modeling can really be used to inform your policy decisions going forward. And I know that will be part of the conversation. I do want to make sure that, to reinforce as you're looking ahead to those ARP supplemental discretionary funds. As a reminder, with the discretionary funds and the guidance OCC released, we strongly encourage lead agencies to use these funds to do cost of quality, providing quality studies to really help move us away from basing payment rates on just market rates and really looking at the true cost of providing high quality care. So you can use the ARP funds to do these studies. You can certainly use them to set your rates at the cost of care and increase those rates. So that's my ARP plug. And with that, I will turn it over to Simon. Thank you.
Thanks, Megan. Hi, everyone. Great to be with you today. I'm Simon Workman with Prenatal to 5 Fiscal Strategies, and I'm joined by my colleague Jeanna Capito, who co-leads Prenatal to 5 Fiscal Strategies with me. What we're going to do, as Nina said, we're going to start by talking about the goals of cost modeling. So as we think about, the different reasons you might use cost modeling and the different options for what you can do with the results that come out of it, it really comes down to thinking about what are the main goals and what are the reasons for going ahead to cost modeling. And you might think, well, it's just subsidy rate setting, but there's actually a lot of additional things you can do with the results of cost modeling. And so what we have on this slide is a list of some of those particular options. So as Megan said, most, if not all states have completed a narrow cost analysis as part of their CCDF plan. And some states will have used a cost model. Some may have used a cost study, a cost calculator. There's lots of different ways to do it. But we know that many states use some version or not of a cost model. So if you have a cost model, as we talk about some of these options today, think about what you can do with the results of that cost model beyond just what you sort of had to do in the narrow cost analysis and in your CCDF plan. And if you don't have a cost model, then it's important to know what you can do with a cost model, right? And then be clear about what is the thing you want to do with a cost model. And then when we start talking about the options for cost modeling, you want to align the design of your model or of your study with the intended purpose. So, first of all, obviously, setting subsidy rates is a key thing you can do with your cost model. As Megan said, states have the ability now to actually set subsidy rates under CCDF using a cost estimation model, either in conjunction with a market rate survey or as an alternative to a market rate survey, if you received approval from the Office of Childcare to do so. And to do this, you really want to make sure you have a robust cost model that can really be customized for your state, can really include all of the regional breakdowns you might have if you have regional breakdowns in your subsidy rate setting system, any additions and adjustments for quality, if you pay tiered reimbursement rates, and all of the different types of providers you might pay subsidy for. So if you're paying subsidy for family, friend, and neighbor care, that needs to be included in the cost model. So, when you think about that as the sort of big setting subsidy rates, you need to make sure you really have a very robust model. Next on the list there, you can use this model not just to figure out that cost per child, but also to figure out what a grant size should be or a contract. Many states gave out grants related to with their ARP funds and stabilization funds, and some states actually developed a cost model or used a cost model that existed in order to help them understand what is the size of that grant that it could be. The same is used if you want to use contracting for slots, right? Instead of, there's lots of resources out there, and we can certainly share more with you if you want them around using contracts and why you would use contracts instead of individual per child vouchers. Often when you're looking at contracts, you really want to understand the classroom level cost of operating. And if that's the case, then again, you want to make sure that the model can do classroom level costs. Then there's specific initiatives, right? Beyond the subsidy system or even within the subsidy system, you might want to be understanding the cost of a particular initiative like universal preschool program or, a particular incentive program to get access to childcare, in non-traditional hours or something. Here, you could have a model or take a model that you have and run different scenarios that really are focused on estimating the cost for that particular initiative, right? So not necessarily just understanding the full-time care of four-year-old care, but if you were doing a universal preschool program that was part day, part year, school day, school year, you'd want to make sure that the model had the ability to cost out on that school day, school year timeline. So, again, that you start to see there, understanding what's your goal becomes important to know, are you building the model that can do the type of thing you need it to do at the end? And of course, incentivizing quality improvement is a part of that as well. That could be a specific initiative. It could be tiered reimbursement. Again, understanding if you have a quality rating improvement system and you pay different subsidy rates based on those levels, you can use a cost model to make sure you understand what it actually costs to be at each level of a QRIS and make sure that the subsidy incentives you're paying or the financial grants or awards you get at those higher levels are actually sufficient to be an incentive to encourage people to be at those higher levels. And then beyond that, you can use it sort of at the more broader systems level, beyond the sort of program level or the per child level, to understand, what is the cost of some of the big systems change that ultimately we all know need to happen in the early childhood system, when we look at, how are we going to make the long-term structural change. You can use cost modeling to really understand what would it cost if we expanded access, if we increased quality across the system? All of these sort of big questions that come up obviously start with a cost per child number for, that slot or, that particular program. But when you talk about, increasing that across the state or territory and really understanding, what it would cost to move the whole system there, you can use cost models and a systems level cost model to understand, what that would cost you. And this is really tied often to advocacy as well. Cost models can be used very much for that direct policy change, and we love to see that happen. But it can also be used on the advocacy side to really make it clear what it takes to provide high quality childcare, what it takes to have a robust childcare system that's meeting the needs of the children, the families, the workforce in childcare, and the broader economy. And so before we kind of talk about some of the tools that are out there, I want to be sort of clear on some of the terms that we often use, because often some of these terms are used interchangeably in the field, the idea of price and cost. And we want to be clear on what we mean when we talk about these different terms and how the sort of different data you may have available to you or you may be collecting relates to each of these, because there really is a difference, and we sort of sell what we need in this system if we only focus on price, because historically price has been what we've talked about in childcare. That is what the market price for childcare is, and it is based on what providers charge. It's based on the market, which is based on what families in that local market can afford to pay. So, a provider might think, I've got my costs, but then the provider has to look at what can I get in this market. If you set your price too high, they're a business. If they set their price too high, they won't be able to fill all their seats. If they don't fill all their seats, they can't be financially sustainable. But we know that that price that providers are setting right now is still unaffordable for most families. Research shows that families are spending significant parts of their income on childcare. It's often the second biggest expense, if not the first, or the second after their rent or their mortgage. Families are paying upwards of 20, 30% of their income on childcare, much higher than the sort of 7%, which is often quoted as what it should be for affordability for families. So what we know is even this price that providers are setting is having a significant burden on family budgets, leaves many families who don't qualify for CCDF subsidies unable to actually afford the cost of childcare in their communities. And so what you get is providers sort of being disincentivized to raise their prices because people can't afford it and they don't want to raise their prices. But because 60 to 80% of the cost of childcare, of the expenses of a childcare program, are on personnel expenses, it is the personnel expenses that get squeezed when prices have to stay low, which is why the early childhood workforce has been chronically underpaid for so long. And especially for programs who rely on public assistance or rely on income, the prices and the low income or middle income families honestly can afford. So that data, you all have access to that data from your market rate survey that all states, apart from the 3 that have done alternative methodology, have conducted, in the last few years. Then there's cost. And this is where, we spend a lot of our time focused on around the cost modeling, because this is actually looking at what does it actually cost to run a program, separate to what they can get in prices. It's what does it cost to the program to meet the licensing standards or other quality and higher standards they may be held to. And this represents all of the costs a program incurs, accounts for any in-kind costs, accounts for being fully staffed. We know from our work with states and providers that often the way providers kind of make it work is they're not replacing staff straight away. They have directors covering in classrooms as floaters more than they would like to be. So here is where we really get down to what are the actual costs for the program and how do those costs actually line up with the age of child. We know that families have the least available income when they have infants and toddlers, but infant and toddler care is the most expensive care. So often what happens is providers set their rates, at infant and toddler rate. There's a bigger gap between the price and cost for infants and toddlers than there is for preschoolers, right? So that is sort of how providers are making this work right now. A lot of states have this cost data they've either done a cost study, maybe as part of your narrow cost analysis, as part of your market rate survey, you ask some cost study questions to understand some of the current costs providers are facing. And this is really helpful data to show that even under the current system, there is a gap between price and cost, especially for certain communities and certain types of providers. But then the third one here is true cost. And this is where we really get into moving towards a better system, moving towards an early childhood field that is not chronically underfunded, that is not operating from a scarcity mindset, is not constrained by the funding streams that they have available. This is where we get to say, what does it actually cost to run a program that meets the needs of children and families and the workforce? A key part of this is including those better salaries and benefits so that you have a workforce that isn't turning over constantly, that isn't dealing with the toxic stress of living in poverty, that actually pays family childcare providers adequately and makes sure that they are able to make a living out of being a family childcare provider and not just having what's left over at the end of the month, having an actual staff, full staffing, and having the floaters and the coverage and the substitutes that you need. To get to this true cost takes a lot more work. You need to build a cost model because then you can really flex around all the different components of this. And you really need to get that input from all the different interested parties that have a stake in this work to understand what is it you really need to pay educators to keep them in this field and for them to make this a career that is a livable career. What is it that you need to have the right staffing pattern to serve the different types of needs that children have? That requires deep engagement with all of the different interested parties across a state to make sure that the cost model there is really reflecting the true cost of meeting all those needs. And so when you look at sort of what is available right now to help you with this work, there are a number of tools available to support cost modeling across states and communities. Many of you may have heard of the provider cost of quality calculator, the PCQC, as it's also known, which is a web-based tool that's offered by the Office of Childcare. The PCQC gives you these state-specific costs. So every state has a sort of default data included in there. It allows you to align it with a quality rating improvement system with different levels of accuracy. It includes childcare centers and family childcare homes. You can also put revenue data in there to help illustrate that gap between expenses and revenue and sort of see whether reimbursement rates are sufficient to cover any increased costs related to higher quality as well as the base level, and allows you to sort of demonstrate some of the different impacts of policy choices that we'll talk about in a little bit. Now, the PCQC does offer a lot of customization. You know, it's got a lot of default data in, but it also allows you to go in and override that default data. But it doesn't allow you to sort of change the basic formulas underneath it, right? It's a 50-state tool. So you know, obviously it has some standardization. So the other thing that's listed here is creating a more customized spreadsheet-based cost model. One of the things Jeanna and I get asked a lot when we talk about cost modeling is like, well, what do you mean by a cost model? And essentially, it's a big Excel spreadsheet, right? A very complicated Excel spreadsheet, but it's hard. It's an Excel spreadsheet. And essentially, that's what sits underneath the PCQC as well. So the states that have developed a customized model, it just allows you to do a lot more customization of, you know, different approaches to quality levels, putting in different job positions, maybe including license exempt or family friend and neighbor care. You know, it gives you a little bit more flexibility. But of course, the trade-off is it also takes a bit more work to get that together. You know, requires a lot more inputs to get there. But you know, all of the states that have implemented alternative methodology right now have used a customized model, so they have it as a tool going forward. And it's one of the things that we've seen states looking at with their use of ARP dollars as a one-time expense, you know, thinking of building the cost model as a piece of infrastructure that then will live on, right? It's not a one and done like a cost study. It's a cost model that then you can modify and implement and change over time as other characteristics change. So from that kind of high level of deep customization, the other two tools that we have listed on here are the first one, the costofchildcare.org, is a web-based interactive that has data for every state and gives you estimates of infant, toddler, and preschooler cost in a center and in a family childcare home, and allows you to sort of turn on, toggle on and off about 8 different characteristics related to salaries and size of the program, whether the program offers certain benefits, etc., to really understand the trade-off between cost and quality, right? You know, these things that we know sort of contribute to a high-quality program, but come with a cost, to really try and help answer that question of, what does childcare cost so much, but people get paid so little, right? It kind of demystifies that a little bit. And is really helpful as a advocacy tool, and to give you some understanding of, well, how are our numbers different from the subsidy rate? But it doesn't give you any customization, right? So again, as you think back to those goals, if you want to just make the case for, you know, why we need more money in childcare, why there's a gap, you can use sort of that tool, but it's not going to give you the customization for rate setting. And then the final one here is kind of an in-between. It's a model that I helped develop when I was at the Center for American Progress, that we developed to help understand the increased cost of care during COVID-19, when a lot of states were making smaller group size requirements, right, to help keep smaller group sizes. And we wanted to be clear on what the additional cost of that was, you know, which in part helped, you know, make the case for why we needed some of the federal relief dollars. But the tool allows a lot of customization around not just things related to COVID, but other things like ratio and group sizes that aren't necessarily COVID ratio and group sizes. You can put in different salaries, some different staffing patterns. So it doesn't have as much customization, but it has some customization. So it can kind of get you some of the way there without kind of going all the way to a spreadsheet-based model. So, across there, you can see there's lots of different options depending on what your purpose is. So, back to that goals slide, it kind of helps you see, depending on what your goal is, will depend on which tool you might want to use, or creating your own tool, etc. One thing I did want to just mention is the PCQC, the Provider Cost of Quality Calculator. Very excited to say that the Office of Childcare is about to release an updated version of this in early October. So any of you who have used the PCQC currently, you're going to see an updated version in the next month or so, which has a new streamlined design. As you can kind of see from the slide here, this will be the new sort of entry page. And I'm personally very excited to see that there will be a few new additions to it, including now it will be able to estimate a cost per child. Previously, it just gave you a cost at the program level. Now it's going to be able to give you a cost per child, which will make it much easier to compare to subsidy rates and other revenue sources that are on a per child basis. It'll also have lots of other new features, including the ability to export your scenarios. So watch for an official Office of Childcare announcement with a link to the updated PCQC in the next month or so. But that definitely will be an exciting tool. And if you haven't checked it out yet, I definitely encourage you to do that when the Office of Childcare releases the new one, the updated one next month. So I'm going to pass it to Jeanna now to talk a little bit about the process of cost modeling before we talk about some of the policy implications.
Hi, everyone. Thanks, Simon. So I'm going to dig us in a little bit more on the idea of cost modeling process. So this particular process that we're going to go through is a little more in line with if you were building a customized tool, but I think that you'll see in some of the components of the process that you could certainly still use the bones of the process to support using the PCQC or one of the other calculators too. It does follow along with and sort of support all of the elements of doing alternative methodology, which I'll talk about in a second as well. But it's not as if these concepts of cost modeling process are only linked to one particular type of model tool. They do support the elements of building that completely customized tool. What you're going to notice is that there's a lot of room in the process and activities based on the goals of what you're trying to achieve with having a cost model. So those elements of that Simon went through around things like rate setting or advocacy or thinking about incentives or other goals that you have within your state system for childcare, those concepts are going to drive how deeply you need to go in each of the steps of building the cost model and what sorts of engagement you do, what sort of data collection you do. All of these things are linked back to the goals of why you're doing the process to begin with. And so that's always an important thing to hold in mind. It's going to be a key piece of thinking about it. So what I want to start us with is talking about this idea of the key stages in developing a cost model. This is a process that we have developed over many years in working with states and communities in their cost modeling efforts. Sometimes it starts with the question of, we know childcare is underfunded. What do we do? X, Y, Z sort of. And so we start with that process of, well, let's step back and understand what does it actually cost so we understand what that underfunding looks like, right? So it can answer a lot of different questions, but oftentimes the original question that sort of is put on the table might not appear to be directly answered by a cost model, but when you start to think about these steps, you can kind of see them come to life. What we wanted to share as part of this best practice is that, as I mentioned, it outlines meeting the steps of alternative methodology. And there's two places. The District of Columbia was the first lead agency to pursue alternative methodology. And over the course of now 3 cycles of submission with their plan under alternative methodology, they use this process for their cost model approach. And the first state that did it is the New Mexico, and New Mexico came online with alternative methodology last year and also used this approach to their cost modeling. And if you're sort of following along with thinking about the steps of or the requirements of alternative methodology, you see how the steps of this cost model development process supports you as a lead agency in being able to achieve meeting all those federal requirements, as well as building a strong cost model reflective of your state and reflective of what you're trying to achieve. And so I want to talk through a couple of the steps because I think this is where you start to get into some of the nuances. So just that first one, the idea of engaging your interested parties or your constituents, sort of all of the individuals that are the leaders and providers and programs that are engaged in your childcare system. This is part of thinking about who you're engaging comes from why are you doing it, right? And really being clear on how important it is that you have provider and program voice be a strong part of the model and sort of almost any of the goals that you may have for the model, since it obviously will directly impact them, whether it's for rate setting or advocacy. At the end of the day, we're talking about trying to bring more money into a system that our providers are the direct deliverers of that service to children and families. So thinking about starting with that kind of core nexus of who are those interested parties, there may be other entities in the state or community or your whichever sort of lead agency you are and who you're working with that you need to then think about partnering with too. We often work with provider associations or organizations that do quality support training for providers, because those entities have a pretty good vantage point on the provider experience and can also reflect their interests as we think about building a cost model. But that why, you can see, is really important to thinking about how you go about it. The goals are going to continue to be important when you think about data collection, because if you're doing alternative methodology, your requirements for data collection are really robust and very detailed out in the federal regulations. Whereas if you're doing advocacy and you're pushing towards a North Star of a living wage for every childcare program in your state, you may not do the ask every single provider what their current expenses are because you're using a living wage for the salary. And so that's the North Star. That's going to generate a very different cost per child from your cost model. And you don't need to do what can be sometimes more burdensome direct data collection if that's your goal. Again, you have to be really thoughtful about how do we make sure that we are doing the data collection that we need based on what we're trying to achieve and how we're going to use the model at the future state. And as Simon said, we're going to talk a little bit more about implementation or use when we think about some of the systems changes and policy decision-making that models can help to inform. As far as developing the model, we're going to talk a lot more about some of how the model can function in a second. So I'll kind of hang on to that one. It's just, again, more about decision making. What are you trying to do with the model? You need to develop a model that has those components in place. And then similar fashion, running scenarios and then using your model to inform your rate and other policy decisions. These things all tie together. Depending on what you're trying to achieve, you're going to run certain scenarios in your model to answer those questions to help informing your rate setting and informing your other decision making that you're engaged in as a state or community. So what we wanted to also do was include those steps in a timeline, just to kind of right size what the work of going from the very beginning of why have a cost model, what am I trying to achieve with it, all the way through to having one and then using it. And while this does look like it has sort of an end, I would propose that after 10 to 12 months, that's an ongoing cycle. And that's why I mentioned the District of Columbia first as the first lead agency. They did a cost model in 2016. They have used that cost model again and again as part of their work. So it's not as if the development may have sort of a point in time to it, but the idea of the resource that you've developed and the tool that you then have, as Simon mentioned, you can invest in it as part of your system or your infrastructure, and then you have it to use in an ongoing way. And it's a repeat cycle of using your cost model after that term of pulling it together. But I think it's helpful to think about the steps of the process and how long they may take, because obviously some of this is to be realistic. Do I have the time to engage in it? Or how do I ensure that I have the time to engage it? We think it's really important. We think it's a critical piece of some of the change we're trying to achieve to really understand the cost of care. But we also need to really understand when should we start in, say, months 1 through 3, engaging interested parties, really beginning to plan, or then engaging in data collection months 4 through 6. We try to guide people to maybe don't launch some of those most deep engagement things right around Thanksgiving to the end of the year. That's sort of the worst time to try and add more meetings to calendars, try to get people to focus on deep content. And so we try to think about that some of these things will take longer based on when we launch them. So we allow for a little flexibility, but hopefully this gives you a little thought on just being realistic about what the amount of time is when you're really building this customized tool that has engaged with and really used your constituents in the development of it. And that's the next piece that I want to talk just a little bit about, is the fact that there is such tremendous opportunity for input in a modeling process, from just thinking about why, to the data collection, to thinking about how the model should function, what should be in it. There's lots of places for input, and they're not all the exact same. The levels of input, the depth of the input, how much time it takes an individual to be involved in giving input. And that's actually a great thing. That's a great way to ensure that people feel that they have been part of the process, but don't necessarily feel that they have to be at weekly meetings or monthly meetings if that's too much of a lift for different parts of that sort of interested parties. And so you want to acknowledge that and allow for that. That flexibility gets more people involved in that true community input sort of style, but acknowledges that not everyone is going to have the exact same role within the development of the model, or then how the model's used after the model's built. So you have some folks that are really critical to helping build it, and then as it's being implemented, they can rely on that their feedback informed the tool itself, and then how the tool gets used is naturally going to be based on that foundation. And so that's a really important piece of it. What wanted to unpack a little bit more on, particular around input and data collection, is an example of how this has looked in other places. And this is actually from a state that has gone through alternative methodology process. This is the elements of it. And so it starts to juxtapose that idea of model development and data collection and input into the model with meeting the federal requirements if you're pursuing alternative methodology, and that you can put these things together for your state or your territory or tribe. And what you see here is that there's going to be that constituent engagement, lots of large and small group convenings, education on why cost modeling, the nature of what cost is different than price, all of those things that we've sort of already framed up today. You're going to want to do that throughout all the constituents and interested parties, because you want people to understand why you're doing it. And that is going to support you. And then moving into data collection that gets at things like, what are truly the current expenses and costs of providers? How do we gather that sort of information? Using an online survey for that, you need to really build a lot of will so that that survey is well received and folks understand the purpose of it. And then adding on the addition of provider interviews and group sessions is also really important, so that there's more voice to how the model functions. Because it's one thing to ask about expenses as they are currently, but as Simon was talking about that concept of true cost, we really need to get to more of what is it that we need to be a viable, strong business that attracts staff and retains those staff once they come to work for a childcare program. And some of that is going to be captured much more through provider interviews and group sessions than we're going to get in an online tool that is only talking about their current expenses. So you want to, again, not just allow for lots of different types of input in the modeling process, but even how you engage in data collection with the provider community and other constituents in the community, what types of ways that you're gathering input and gathering data, it varies. The data you gather from an online survey is clearly different than what you get in a group session or a dialogue about how the cost model should function or what challenges folks have to delivering higher quality. But those are all things that actually feed into the functioning of the cost model. And that's actually where we're going to go next, to talk a little bit about how models function. This is supporting you to coming together in a tool that does these things for you. There's sort of a base of how tools function. And one of the core things that we're always really clear about is that even though you have a lot of opportunity for selection within a cost model, there are certain core features to how the model functions. It's always going to have what it means to meet health and safety standards under licensing in a given state or community. That's really important, that we know there's sort of not a universe where you're modeling a program that doesn't meet health and safety standards under licensing. You're not modeling a program that isn't legally operating in the state or community that it exists in. Those are features to how the model is built and how it ends up then being customized or tailored, right? Because those things differ state to state, even can differ city or to community within a given state. It includes all mandatory employer taxes or coverage for breaks, because again, that's part of that sort of legally operating program. And we don't want to be modeling not being able to achieve coverage for breaks for all the staff in a program. And then it also includes getting more into the nuances of what you're trying to achieve, the regulations related to a given program type. So if you're modeling birth to school age programming, then you want to have all the regulations. If maybe the school age programming has different regulations than the programming for children under 5 years of age, those both have to be in how the model operates. That has to be part of that base so that you can understand that all of those elements are accounted for in how the model runs its formulas and the outputs that come from the model itself. It then includes all of we talk a lot about personnel and compensation because, as Simon mentioned, it is such a huge percentage of the expense of a childcare program. But we also know that it is important that we have all those non-personnel expenses in as well. And so another core piece of general model functioning is that it does have all the non-personnel for the typical operations of a childcare program, whether it's a center or a home, are baked into how the model functions. Where you get a little bit more opportunity for customization is then in the quality variables or other enhancements that you add on to a model. You might not get as much of those when you're looking at those online calculators, but if you're building a tool for your own state or community, you have a lot of opportunity to add on quality variables reflective of, again, what questions you're trying to answer and what goals you have for using a model. And so this all is coming together and to support you in this idea of, well, what are some of the systems changes or the policy decisions that we're trying to inform with having a cost model? And before we go more deeply into some examples of those, just wanted to quick and highlight how we take these things together and put them into the idea of how the model functions. So there's certain determinations that need to be made in how the model functions. I went through at the highest level how a model works, and then that idea of those quality enhancements that you may have in the model. There's a slide in the deck that goes through sort of the whole universe of quality enhancements that may be in a model. When you're then running the model, you have to make these determinations in order to have it support you in that decision making. So depending on what your goal is, you're going to look at across how the model functions and think about things like, again, the ages of children served. Are we talking about a scenario where we want to understand birth to school age? Or are we only talking about modeling for children from birth to 5 years of age? That's a selection or determination that has to be made when you're using the model in order to get the output that you expect, right? We don't want to model services for school age children if we're only trying to answer questions for children that are in full day care from birth to 5 years of age. So that's one of those examples of running a scenario or a selection that you make. Even things like the number of children served, whether the facility is in a school or a center-based program or a family childcare. These are all things that will generate different results in the model because they're different types of modalities of delivery of care. And so these are some of the determinations that support you in thinking back to, okay, what is the goal? What type of policy decisions are we trying to inform? What type of activity are we trying to inform with our model? Now I go and use the model and make some of these selections, and then I'm supported with those outputs to inform our decision making and decide sort of what's going to come next from the results that we got from the model. And so with that, I'm going to turn it back to Simon, and we're going to talk more about this idea of some examples of those policy decisions or systems changes that folks have made.
Thanks, Jeanna. So yeah, as we think about, what you can do with it in terms of making those policy decisions, we've thought about it in sort of two big areas. The first is about building capacity for higher quality in the programming. And the second is about increasing access and building capacity for, and especially for certain targeted populations. And so, as you start thinking about that, there's both the sort of decisions around what you want to do, but also around the decisions about how you will do it, which gets both into back to the goals, of what you're doing in cost modeling, but also around what is the funding mechanism you're going to use to actually take from, now we've figured out how much money is it's going to cost to do this, what is the way you're actually going to get it to there? And that's, what you see here on the green box on the screen is the sort of thinking about the funding mechanisms that go beyond the subsidy system, or at least go beyond the sort of subsidy voucher, subsidy reimbursement on a per child basis. So whether, as I mentioned before, talking about doing direct service contracts where you're actually contracting for slots or contracting for a particular service, Having the tiered payments within the quality rating improvement system, which could be tied to subsidy, but also doesn't have to be tied to subsidy, right? For if you're going to give sort of bonuses or grants to providers who achieve higher levels in the system, and then thinking about those incentives and those grants, and thinking about, are those grant amounts sufficient, and are those incentive amounts sufficient to do what you want them to do? When you look across what states have done around tiered reimbursement, without cost modeling, you're sort of setting a higher percentage or a higher dollar amount aligned with that particular higher level. With cost modeling, you can really get down to understand what it costs to be at those different levels. So when New Mexico moved to using a cost model in 2021 to set rates, not only did they use the cost model to understand what the rate should be at the base level, but it also, for each level of their quality rating improvement system, they were able to estimate with the cost model, what does it cost at each level? So not only did they change their base, they also changed their tiers to get there. One of the things we saw a lot of states doing during the pandemic with their relief dollars was moving to paying on enrollment rather than attendance, right? So this is another thing where, it's not on its own, a cost strategy necessarily. It's in a cost model, but the cost model can help show why you should do this. That's the point here, is that if you have all the expenses of 10 children in a classroom, of having the 2 teachers and, the space, if you only get reimbursed for 8 of those children, if you only take income for 8 of those children, that's a huge difference on your bottom line. And the cost model can show that, to show why you should move to paying on enrollment rather than attendance, as well as other policies that a childcare program might be doing around business operations, right, about effectively managing a wait list, etc., and why it makes sense for states to be investing in those business supports and business professional development for providers. Of course, compensation is a huge issue across the field, and it's something that the Office of Childcare is very focused on and has recently put out an IM around, how we can start moving forward on compensation. Again, the models can be used to help understand what it actually costs when you increase compensation, right? And what it means to add on higher compensation, what it does to the sort of bottom line of a provider, to make sure that there is sufficient funds for them to do that, right? And that those funds are stable, which then goes to the funding mechanisms of, moving to a contracting basis where it gives some more stability to the provider, can really help to understand what it's going to cost, to make sure that you have that stability to say, I'm going to increase pay for my staff because I know that my income is more stable because I've got this contract for slots rather than it based on individual children and the sort of moving numbers of subsidy children that may have come in and out of a program. Of course, also, you can address compensation by, back to my slide on the price, cost, and true cost, by having a higher salary built into the true cost is a real way where you can start to push salaries in cost modeling. Of course, unless a program is 100% subsidy, or they can get higher tuition from private pay families, you can't necessarily tie exactly the higher rate to higher salaries, but you can start to move that way. And, we've seen Virginia did that with their proposed new subsidy rates, which are based on a cost model. They set the salaries in the cost model as being closer to parity with a kindergarten teacher, to sort of move salaries forward. And we're not requiring that of programs, but are saying this higher rate is based on paying teachers more, and that is an expectation we're looking to see providers start to make. And we know that providers want to do that, right? They want to be paying their teachers more if they have the revenue to do it. Of course, then there's also the District of Columbia, which launched a compensation pay equity fund, as a way to really increase educator compensation even beyond the subsidy system. Recognizing that there are lots of families who cannot afford the cost of childcare when educators are paid sufficiently but you also don't qualify for subsidy. So how do you get money to those families? And you can use the cost model to understand what is the amount of money, what is the gap between where we pay right now and where you need to be paying. And from an advocacy side, you can also show how this increased money is going to the workforce. You can show that, yes, the cost of childcare has now gone up a percentage, but 90% of that increase is going to the workforce, is going into the pockets of the of childcare teachers who are, going to be going out and spending it in the local economy, and spending it to support their own families. And of course, moving to setting rates fully on alternative methodology, can be a huge strategy for increasing access to quality programs. When programs can actually get compensated for what it actually costs them to run a program, you can see more programs likely to accept subsidy, because accepting subsidy is more financially advantageous to them than maybe it was previously when it was below the market rate. And at those higher quality levels, alternative methodology can ensure your subsidy rates are aligned with those actual increased costs at different quality levels. And so then the last thing I want to touch on is about building capacity for access to care for specific populations. Of course, all of the things on the prior slide sort of support this as well, but we know that there are disproportionate impacts of the current system on infants and toddlers, on children in underserved areas, often in rural communities, and also in family childcare settings. These are the places where the gap between what families can afford to pay, what the market price is bigger. Between that gap is largest between the market price and the cost. And so, obviously the ideal is, you increase everything, but in a time of limited resources, we know states have choices they have to make. And so one of the things you can do with the cost modeling is understand what the gaps look like for different populations, and understand, where those bigger disparities are, and then start to target your changes, your incentives, your investment strategies based on where those gaps are biggest. So, and that can really make sure you're addressing those infant toddler childcare deserts. It can address the lack of childcare in many rural communities. And for family childcare providers, where we've seen a significant decline in the last sort of decade or more of family childcare providers, which is a population, a type of supply that serves some very specific populations for very specific needs. When we lose family childcare, we lose a really key part of the system. And so making sure that you're understanding what it really costs to run a family childcare program, where the provider owner is not living in poverty or has to rely on other income in their family to be able to operate, is a really important way to make sure that you are using the cost model to capture what it really costs to provide care in a family childcare setting, and you're accurately comparing family childcare costs to center-based costs, and making sure that as you look across your state, as you look across all of the needs in the state, you are targeting your investments to where the gaps are greatest and where the impact of this market-based system that has been in place for so long has been so disproportionately negative, and really starting to address that with your cost modeling. So I know we've covered a lot of ground across the last 50 or so minutes. I know some questions came through the chat. I'm going to pass it back to Nina now to facilitate some Q&A for a few minutes.
Thank you, Simon. We've got quite a few questions that have come in, and Jeanna and Simon, you've got this down so that I know you stayed on top of many of them, and it looks like Jeanna's still typing an answer to one. But I'm going to go ahead and bring up the one that I think Jeanna just answered. So it should be at the bottom of the answered questions. And I'm going to raise this because I know it's a question that lots of people have. So the question is, are there recommendations for phasing in the implementation of the results of the cost model, given the decreasing appetites for funding from administrations due to the softening economy? Is there a mechanism to create a phase in over the years? And this person's from California, who's just recently worked with you all. Jeanna, do you want to, since you just typed a response, do you want to share a little bit of what you typed and maybe elaborate if necessary?
Sure. What I was focusing on is how important it is. There has to be a multi-year plan. There's sort of no, and while I was typing, I was hearing Simon's piece, and it sort of illustrates that, how important it is, because you can't, it's unlikely that any state, no matter the economy, can do everything at once, especially in a 1-year term, right? There's the issue of just sort of the getting all the dollars out the door, if you had all the dollars you needed, and getting them to providers in a way that providers can make use of in a quick turnaround. There's just a lot to that. And you've all learned that very much, right, with ARPA dollars and grants to providers. So there's the reality of what revenue is available in the year 1 of the change, year 2, year 3, but you have to have a plan for thinking about what revenues do I need to have available, right? The cost models answered some really critical cost per child questions. Now you have to take those and put those together with those policy decisions, and then also add on to that. So if we go with Simon's example of the infant toddler care, which is such a huge disparity in the cost for infant toddler care compared to available revenues, it's often where states are first saying we need to address this, because it's also an area of there's a lack of access to infant toddler care. So we need to go at this policy issue sort of first. Well, then you have to say, okay, how many infants and toddlers are in care? How many infants and toddlers could be in care, to understand how much that investment needs to be in year 1. And that's basically where you're building a multi-year finance plan for the set of policy decisions or strategies that you're going to be implementing, and acknowledging if we start in year 1 and we can get to 50% of the investment we needed, okay, how do we then roll the rest of that investment to year 2? How does that change our year 2 investment, right? This is then when it becomes that revenue side of the equation too, to understand the reality of what we can achieve and how that impacts our policy decisions. I was also working on pulling up a sample of a 4-year finance plan that was done by a state that exactly addressed this idea that you're not going to do it all in 1 year, but you can build a plan so that you're at least have a goal of where you're going to get to, and then think about how your investments match with that goal. So I'm trying to get that in the chat for folks too.
Thanks, Jeanna. That's great. And Simon, I know you started to answer this one, but I think it's a great question. What are some examples of quality variables and enhancements?
Yeah, thanks, Nina. So quality variables and enhancements are really things that are related to anything that goes above and beyond licensing. So that might be providing planning time. Most states don't actually require planning time in their licensing requirements. They might in their quality rating improvement system. But one of the things we talk about is including things that even go above and beyond what might be in your QRS, depending on how robust it is in your state. So that way you can include what would it cost to give teachers, an hour a day of paid planning time away from children. And the way that gets turned into a cost is then you're talking about you need a floater or a substitute in there to actually cover that time. Then there's other things like if you're doing family engagement activities, such as family conferences or additional family activities, or even up to the extent of having a family engagement staff person, especially in some of the larger programs. Things like child health and development, having, some additional nutrition support or a health and behavioral screening, some of the tracking of health, dental and vision, any of those things that go above and beyond what's in licensing, we would put down as a sort of enhancement or a quality variable. Often it really is about, and for us, when we're doing the modeling, we really focus on what are the things that have a cost to them. And, so sometimes that's about materials, right? If you're having additional curriculum, etc. But often it is about staff, right? It is about additional time, additional people in the program to help with professional development. And even if the professional development is free and offered by the state, the time for the teacher to step out of the room to do that, right? The time to have to engage in those family engagement conferences, to do those educational supports. You kind of list out what all those are, and then you have to go through and figure out what is the actual cost that is associated with them, so that can be built into the model.
Thanks, Simon. That was a helpful, thorough response. And we're running up against our time, but I do just want to note that there were a couple of votes for the comment from Nathan about seeing that example of a 4-year finance plan. So I don't know, Simon and Jeanna, if you have something like that on your website that you can refer people to, or the best way to get folks access to something like that, but it does sound like it would be helpful.
I did put the link to the plan in the chat, but there's also several other types of resources and examples of there's a map of all the states and who's done cost models and cost studies that's available. And so we'll put the link to our site in the chat too.
Great. Well, thank you everyone for your engagement in the call. An hour just flew by and we're getting more votes for that finance plan as I speak. So I just want to thank you, Simon and Jeanna, and Megan, thank you for being on as well. It's always nice to have OCC support. And when you all close out of Zoom, just want to give you a heads up that an evaluation will pop up, and we really encourage you to take time to complete the evaluation. It's short and super helpful for all of us. As I said before, the slides in the recording will be available and posted on the CCTAN website within the next couple of weeks. And again, thank you to all the participants, and we hope you all have a wonderful afternoon and coming week. Take care.